The Healthcare Transformation Task Force came together to accelerate the transition toward value-based payment and delivery system reform. And to do that, they realized that there are several primary channels underway right now in the country toward value-based payment. And part of what they could do as a group was to help learn the best practices around the country in these areas and then disseminate those best practices so that payers and purchasers who are implementing new programs would have the benefit of what's been learned already. Now, in reality, that has boiled down to three primary channels of work. The first is accountable care organizations, even though there are many forms and structures of that. The task force wanted to look at what's working in the ACO space and then transmit to groups like CMS, the Medicare program, and to private payers, what are the key elements of successful ACOs that should be included in future programs. Secondly, they felt that bundled payments are an important part of the transition from fee-for-service to more risk-bearing provider arrangements. And again, they understood that there were a number of areas where bundled payments have been moving more rapidly, some of them under CMS programs and some of them in the private market. And they wanted to understand what are the key elements of success. For example, the definition of what's in a bundle, when does it start, when does it stop, what services are included, what are the performance measures for a bundle, how do you measure successful outcomes for a knee replacement bundle or a cancer bundle. So bundle payments has been a second area of collaborative work to identify best practices. And the third is called high-cost patients, realizing that most of the provider systems that go at risk really have to focus on the most expensive patients, often not getting well-coordinated care, often using unnecessary services because their care is not well-coordinated. How do we identify those people early and help them get into the best hands to get the most coordinated and appropriate care, to get the best outcomes at the most appropriate use of resources? So those three work groups, ACOs, bundled payments, high-cost patients, are all active right now, identifying some of the best practices across the country and trying to write those up, consolidate them so they can be shared with people developing new programs.